don't have the machines. They get old and replacement is very difficult. Staff welfare is no longer there. We used to get sugar. We last got in April. And when we talk about it, it's like they want to take us to the ED. But we are entitled.
This is Dr. Louisa Namata, the in charge at Kiswa Health Centre 4, a KCCA managed hospital, speaking about the status of service delivery at this facility. Her story is a reflection of the challenges plaguing health facilities countrywide. In this story, we examine the severe service delivery and accountability gaps plaguing public health facilities with the direct focus on two key KCCA managed facilities, Kisenyi Health Centre 4 and Kiswa Health Centre 3. The situation, described by administrators as deplorable, stems from a lack of essential resources and deep financial distress. Dr. Sala Zarango, the acting director of public health at KCCA, says the directorate has over the years suffered budget cuts from 37.7 billion shillings in the financial year 2017-2018 to about 16 billion shillings in the financial year 2025-2026, leaving them with a funding gap of 171.6 billion shillings in this financial year.
The medical side, we allocated 16.9 billion. 10 billion is for wage, 6.9 is non-wage. So what's going to the hospital literally is 16.9 billion, and of which the biggest percentage goes to pay the salaries, which is about 10 billion.
At Kiswa Health Centre 3, the in-charge, Dr. Louisa Namata, outlines the facility's existential challenges, ranging from insufficient equipment to poor staff welfare and inadequate drug supplies.
I have nursing assistants that come from far. They get very little pay. You don't expect them to come every day. If I spend 20,000 every day on transport, and I earn around 300,000 per month, no more allowances. Even us in these positions of responsibility, no allowances. Drugs, they tell you they are going to deliver today, but then they come 2 weeks late. And the medicines they give us usually last 2 to 3 weeks. Really, they don't finish the third week.
The pressure is equally intense at Kisenyi Health Centre 4. The facility manages over 600 patients daily, and Hospital Administrator Edson Mugisa stresses how understaffing and poor staff welfare make coping with this high influx a daily struggle.
For instance, here at Kisenyi Health Centre 4 in the outpatient department, we have 2 clinicians who died. They have never been replaced. Then we have one who retired, also has never been replaced. And when you have a monthly attendance in outpatient department of 2,800, currently we have 3 medical clinical officers who are overseeing all those patients. It's really a big problem.
Mugisa further highlights critical issues that undermine patient care, including frequent equipment breakdowns with minimal maintenance support and consistent drug stockouts.
The repairs of medical equipment are often delayed. This creates a gap in the service delivery, which can lead to misdiagnosis if the medical equipment are not repaired on time, because we send our requisitions to the head office, but it takes time. If we had a biomed who's recruited and stationed here, he will be doing a great work. And then we have frequent stockouts of medicines, vaccines, and medical sundries like gloves and the sutures which are used in the theatre. Late deliveries of medicines by national medical services are another challenge.
Amidst these service delivery struggles, the focus also turns to patient empowerment. Meba Musinguzi, Programs Officer at the Uganda National Health Consumers Organization, notes a critical awareness gap among the public.
People do not know their rights to health services. They don't know that they are entitled to such services. The facilities in KCCA do not have these sessions. They don't teach the communities about their rights. Some of these rights are not put out there for people to know. So you find that even if the patients are aggrieved, they end up going back either to these private clinics or resorting to using herbal medicine or other means other than going and trying to actually talk to the facilities or the administrators.
In response to concerns about misconduct, Dr. Zalwango assured the public that the Directorate has implemented various transparency mechanisms across all KCCA facilities, specifically to prevent extortion, corruption, and drug theft.
We do exit interviews to inform us real time. We've also put talking compounds to show that these services are for free. And we've given a number of telephone contacts, starting from a toll-free line, WhatsApp, the manager's number, the director's number in all facilities. But knowing our clients that we serve, most of them are timid. They don't want to come out. So for that, we've even put suggestion boxes outside so that people can be able to give us feedback in real time. It's now a must for the staff to wear uniform and also put a name tag on it so that we can easily identify them.
However, there is a concrete improvement plan. Following recommendations from the Parliamentary Committee on Health, the Minister of Health is taking steps towards upgrading several KCCA facilities. This includes elevating Health Centre IVs like Kisenyi and Kawaala to General Hospital status. The Minister of Health spokesperson, Emmanuel Ainebiona, confirms the commitment to this crucial development.
Now we are set and discussions are under. Already they are looking at how best these facilities can be upgraded, and that will come along with the infrastructure, constructing new infrastructure. So all those discussions are now under at Kiswa, Kisenyi, and also Umambo and Kawaala. So already there is groundwork being done in preparation for the upgrade, because the upgrade comes with increase in bed space, increase in the number of clinics, increase in the number of services.
For now, as health workers continue to struggle under difficult conditions, Kampala's growing population remains at the mercy of the underfunded and overstretched health system, one that urgently needs investment and reform. For Sanyu FM, I am Umaru Senyonji.